Hi everyone, this is Jessica and Katie, and today we are presenting on glutamine and its effects post-exercise.
So this is our glutamine supplement that we were able to find. It is a glutamine powder, and for the 58 servings one, it is $24.99. The cost per day is 43 cents, and as you can see, the main ingredient is just glutamine. And here is our supplement claims. It says that during the prolonged intense exercise, the glutamine levels are depleted, which can limit protein synthesis. So this can supplement your diet and can replenish those glutamine levels. So what is glutamine? It is a non-essential amino acid and is the most widely available and versatile. So the supplement was correct. It has many roles. The participates in the metabolism of nitrogen exchange through ammonia. It does acid base regulation, participates in gluconeogenesis. It's the precursor for nucleotide bases and the antioxidant glutathione. And it also participates in immune system support. The main metabolic organs that release glutamine into circulation and controls its availability are the gut, the liver, and skeletal muscles. For GI function, the small and large intestines are capable of metabolizing large quantities of glutamine supplied by the bloodstream or diet. When the glutamine is hydrolyzed into the glutamate, it is catalyzed by glutaminase GLS, and so glutamine concentration is low in the intestinal tissue due to that high GLS activity and its high affinity for glutamine. So there is a relationship between GLS and the use of glutamine by certain cell types in the intestines. So almost all GLS is found in intestinal cells, which are tied to the mitochondrial membrane. And the regulation of GLS helps to maintain tissue integrity, activate sufficient absorption of nutrients, and prevent bacteria from getting into the bloodstream. So it's important that glutamine comes in and is supplemented through the diet or the body to help regulate the GLS to keep these functions going.
So the first research article that we looked at is titled "The Effect of Glutamine Supplementation on Muscular Damage Biomarkers in Professional Basketball Players." So this was a double-blind, placebo-controlled trial with two-stage crossover study. The participants were 12 professional basketball players. Glutamine supplementation was 6 grams, and that contained lactose, starch, and glutamine, or the placebo, which just contained lactose and starch. This was given orally for 20 days. And then at day 20, the groups were crossed, and this was a blind switch. So the results from this study showed a positive effect of supplementation on recovery after training. It was also seen a decrease of muscle damage markers. The authors did note some limitations, such as the low number of participants, and there was no assessment based on court position. So the authors conclude that glutamine supplementation can decrease muscle damage and balance catabolic and anabolic hormones. Glutamine supplementation can also help the recovery process after training. Another study titled "The Effect of Glutamine Supplement Administration on the Reduction of Muscular Fatigue Post-Eccentric Exercise." This was a randomized laboratory experimental study with a pre-test and a post-test design. So there was a control and experimental group, and there were 2 groups of 22 students per group. The glutamine supplementation was 0.4 grams per kilogram of body weight, and that was mixed in 450 milliliters of mineral water 3 times a day for 3 days. And the placebo was just mineral water without the glutamine. So the researchers measured muscle strength and joint range of motion, and that was taken 4 times a day after activity, 1 hour after, 24 hours after, 48 hours after, and then a final 72 hours. The activity was drop jumps, 10 reps and 10 sets, 1 minute per set. So the results of the study showed that glutamine supplementation after eccentric activity increased leg muscle strength and significantly increased knee joint range of motion 72 hours after exercise. So the authors conclude that glutamine can increase leg muscle strength and knee joint range of motion 72 hours after eccentric activity, specifically with a dose of glutamine of 0.4 grams per kilogram. Another study that we looked at is titled Glutamine as an Anti-Fatigue Amino Acid in Sports Nutrition. So this was a review article, and it reviewed anti-fatigue properties of glutamine, analyzing literature in regards to the supplementation. So there was 55 studies, 44 were original, and 11 of the studies looked at were literature reviews. The keywords that the authors searched were glutamine and fatigue. 22 of these 55 studies were human trials, and most studies included male participants who were physically active or athletes. The results from the literature showed consistent glutamine supplementation seemed to benefit muscle glycogen synthesis and reduce ammonia accumulation caused by exercise. Glutamine supplementation can also decrease markers of muscle damage. Glutamine seemed to have little impact on performance, although it did improve recovery. And then glutamine supplementation can be used to increase availability and is suitable for product use. The authors did suggest more research is needed to determine glutamine supplementation alongside carbohydrate-containing supplements. Another study is titled Glutamine Supplementation Reduces Markers of Intestinal Permeability During Running in the Heat in a Dose-Dependent Manner. So this study was a 4-arm, double-blind, placebo-controlled, randomized crossover design. It included 10 recreationally active males in their 20s. There were 4 exercise trials, so 1 placebo and 3 glutamine trials. And the doses were 0.25, 0.5, and 0.9 grams per kilogram of fat-free body mass. Blood samples were taken to measure plasma, glutamine, and intestinal fatty acid binding protein. The authors wanted to assess GI symptoms and permeability. So they discovered that the LR ratio, which is lactulose and ramenose ratio, increased after exercise in all trials compared to at rest, which makes sense. And then post-exercise, L and R ratio was lower after supplementation, even at the 0.25 grams per kilogram compared to the placebo. So even at the lowest dose, the lactulose and ramenose ratio was lower due to supplementation of glutamine. And this shows that the GI integrity of athletes running in the heat can be improved by glutamine supplementation prior to their run. And glutamine supplementation had no impact on GI symptoms, which was something else that they were looking at. So the authors suggest that more research could be done in this area. Another research article that we looked at is titled The Effects of Supplementation with BCAAs and L-glutamine on blood fatigue factors and cytokines in juvenile athletes submitted to maximal intensity rowing performance. So this study participants included 5 juvenile male athletes. The athletes received a placebo, BCAAs, or glutamine for 7 days prior to testing. The dosage of BCAAs was 3.15 grams per day. The L-glutamine was 6 grams per day, or they were given the placebo, and each of these were given 3 times per day. Exercise was the 2,000 meters of rowing, and this was performed on an indoor rowing machine. The participants had 3 blood tests measured, 1 at resting, 1 at the end of exercise, and then 30 minutes post-exercise. And the researchers analyzed blood fatigue factors such as lactate, phosphorus, ammonia, creatine kinase, and blood cytokines. The results showed that blood lactate was not significantly different between groups, and neither was blood phosphorus concentration. Blood ammonia concentration in all 3 groups was higher after exercise and varied by stage, but there was no significant difference between the groups. The level of blood cytokine activity or creatine kinase activity was higher in all three groups after activity, and the glutamine supplementation had the best effect of lowering these levels. So the authors conclude that glutamine supplementation can decrease fatigue factors in the recovery stage in comparison to BCAs or in the placebo supplementation. And then another article that we looked at was titled Surface Electromyography Assessments of the Vastus Medialis and Rectus Femoris muscles and creatine kinase after eccentric contraction following glutamine supplementation. In this study, there were 17 healthy untrained males ages 19 to 25. This was a random double-blind test study with a test and a placebo group. The glutamine dosage here was 0.1 grams per kilogram of body weight, and the placebo was the same amount, just with maltodextrin. This was administered 3 times a week for 4 weeks. And the research measurements included measuring the median frequency and mean power frequency of the vastus medialis muscle and the rectus femoris muscle. And they also measured creatine kinase levels after eccentric contraction. Results showed no significant differences between the test and the placebo groups in regards to the 3 measurements. So the authors conclude that glutamine supplementation has no positive impact on muscle injury markers post-resistance training. I do want to say, though, that this was a lower dosage than the other studies. So I'm curious to see if they had used a higher dosage of glutamine supplementation, if the results would have been different.
So overall, is it safe? Yes, it is most definitely safe since it is found in the body and can be ingested through food. The recommended dose, if it is fixed, it's 20 to 35 grams over 24 hours and 0.3 to 0.5 grams per kilograms. And it did not specify a time frame. It just said the 0.3 to 0.5 at the research I looked at. And when given in high doses, it can cause hyperaminoacidemia, which is really needs to be looked out for with people who have renal disease, who need to watch their ammonia levels anyway. So we want to make sure that, especially those with renal disease, they visit the doctor before taking the supplement, or if it is just a concern, just visit the doctor as well, because this is a protein, which is amino acid. So when given in high doses, proteins can lead to that. And one study mentioned up to 0.65 grams per kilograms have been tolerated and did not result in abnormal plasma ammonia levels. So conclusion, it is safe to use. The evidence supports recovery after exercise, decreased muscle damage after exercise, decreases fatigue, and increases gastrointestinal integrity. We recommend getting it from your diet before supplementing, and be mindful of high ammonia levels and high dosages if you choose to use this supplement. And we did want to conclude as well that each athlete is different. So where one may see results, another may not.